princess of Cappadocia gave the name diabetes. Basically, the word diabetes means a passage through a siphon. So one polydipsia and polyuria was this, and in Thomas Willis, he gave the term as a mellitus because of the sweetness and beauty, and that is the cause for this. If we go for this, the whole revolution in 1922, William Bentley-West, and you can't forget contribution to this, our dog, on which it was experiment was done, and the whole picture of this diabetic quality of life has been tremendously improved in this. Can you enumerate? This boy was on the historical base. This is the boy whose name is the Thompsons. You know what Thompson? The first patients who received the insulin. And this is the first patient in Toronto. It was in Canada, and it has been done on this. Diabetes in India have a very tremendous name. It varies from north to south. Somewhere, mostly it is known as the Madhumeha in Sanskrit, Hindi. In north part it is known as Chini ki bimari. In some extreme north it is Sakkar ki bimari. Somewhere it is the Bahumutra Rog. In Assam or somewhere it is a Brahmana. In extreme northeast or Nagaland and this. You see, Jakravyadhi in Tamil Nadu and Mitha Pesab. You see, in Sindhi people used to tell it when Mitha Pesab. So, in north to south, the names in diabetes is such a common, and in the people are affected by this and conscious also. They are conscious, but the correct scientific way is how to guide them so that their life can be prolonged and without the high diabetes. So various names in this of various. Now the global problem, you know, it is a tremendous of this 2030. People will around 55 million in India and China. Even already India exceeded the Chinese people regarding this in diabetes. So India is the diabetic capital now. Cardiovascular, what is my risk factor? Diabetes. One Finnish scientist have said diabetes is a part of cardiology, and cardiology should treat diabetes. This is a bold statement he has given throughout the world, because diabetes is coronary equivalent status, and we prove the data that it is the 70% of diabetic people died with cardiovascular complications. So whole our study research last 30 years in this has come with this risk factor for various cardiovascular death. One factor, two factor, three factor, four. Bigger four killer. Yesterday we are discussing. There are four bigger killer of this world which is a preventable. It's diabetes, your hypertension, your cigarette smoking, and dyslipidemia. Top four. And these are four monsters for the heart disease. Here, the established factor in type 2 diabetes is non-populations, and various differences versus the men and women. You see equally, women and diabetes. Whatever women have a protection by due to his natural estrogenic hormone, that is lost if she is diagnosed as a diabetes. So in men, if the diabetes woman and the risk factor of men is equal, whatever protection in early 50s up to 50s, that is lost. So all the data is going in favor of that. Biggest study is our Framingham. We know Framingham heart study, 30 years long data, and they are saying that diabetes in various ages, total cardiovascular failure, claudication, stroke itself is a cerebrovascular. So our macro and micro complications, macro vessels complications with coronary, cerebral, and related peripheral, but the micro vessels complication are eyes, kidneys, and the nerves. So these 6 complications is our target. In atherosclerosis in diabetes, 80% diabetes mortality is leading due to atherosclerosis. And you know, whole world is trying to find atherosclerotic prevention. In Australia, some scientists have polypills concept, 6 tablets every day with breakfast, so that we should not go for the atherosclerosis. Because in atherosclerosis, you know, fatty streak in everybody's body. Everyone's, and at the age of 15 to 17, there is a fatty streak. Now, thing is that what the factors, these factors leading to formation of the thrombus and atheroma and gradually the plaque rupture in this. So, whole is the 70-80% diabetes, 75% atherosclerosis, 25% peripheral vascular disease, and you know 75% hospital of due to diabetic complications. You discuss women are always high risk, and whatever the eliminate relative cardioprotection being premenopausal women, diabetes, no benefit in diabetes. So it is always in diabetic women MI more mortality. This is a strong heart study. This is a strong heart study. Typical CVD is male and women. You know, one woman will be diabetes, they have a higher risk. Hypertension always is a challenge. You know, 75% of type 2 diabetes is hypertension. Later on, diabetes will be converted in hypertension. So they are just gradually have a lot of complication of this. And especially for postgraduate, I like to tell you to read this trial, which is the UKPDS, best study, biggest study for diabetes. United Kingdom prospective diabetes study, and what a lot of data came. Now there are some challenges, some are accepted, some are been challenged on this study, but still this is the best which is in favor of intensive versus conventional treatment of this. UKPDS, we are discussing now the controversy versus UKPDS is whether it is the tight control versus this tight control of this. हाँ बाद में एक घंटा के बाद this is the UKPDS of this next. Diabetes, sir, one of the important is Helsinki heart. It is a very old study regarding diabetes with the lipids, and whether in that time dyslipidemia and regarding the end result of this myocardial infarction and death related that has been studied. This is a meta-analysis of various type of number of events, mortality, CVD, major events, any event, bypass versus this cerebrovascular accident. So what is when simvastatin is better, and it is now been a treatment for antiplatelet and statins, one of the important factor for the mortality morbidity reduction. I will discuss for data's point of view. One is the Barry trial, very famous Barry trial, and because why? Because most of the coronary artery and it's a peculiarity in diabetes, 5-6 peculiarities diabetes versus non-diabetes with coronary artery. One, most of the diabetes have a multiple vessel disease, diffuse disease, distal part of disease, and the lesions are not normal in single intraocular part. So most of the studies was that Bari was a basically bypass angioplasty trial, and where it is a benefit of the bypass in patients of diabetes and with a long age. But in that time, a PTCA was done with a traditional with balloon angioplasty versus early bare metal angioplasty. So that has been challenged now, but still the multivessel disease, the choice is always choice is your mostly the bypass surgery. CVD prevention. You know, this is the metabolic global cardiometabolic risk. This is the CMR, cardiometabolic risk. When diabetes equivalent to coronary because of the CVD mortality and all the big 5 metabolic syndromes, you know, the hypertension, triglyceridemia, LDL, insulin resistance, and sugar. These are particularly for the sub-Asian population. It was found that it is rampant. It required only 1 day if you measure, including myself. You look the abdominal. It is a drastically increasing. Become our South Asians. It is a major problem that simple overweight is leading to insulin resistance, obesity, and this cause for the future for the diabetes. So it is a challenge. Every day we are seeing 10 to 15 patients, new patients having this